everyone, I'm Dr. Karishma and today we are going to discuss about a rhinoplasty surgery which is done on a male patient. So this patient, who is in his early 20s, came to us to correct his nose and to correct certain features about his nose. Now let's have a look at what his main concerns were. So his main concern was the side view of his nose, which had a very prominent hump on the nose bridge, and he wanted to correct the nose bridge on his hump. He did not want to have a very small nose. Now, being a male patient, usually for men, we like to have a more broader or more bolder and sharper nose. So we do not look at reducing the size of a male nose too much, but we look at refining the existing shape of the nose. So he wanted to reduce his dorsal hump. He wanted to raise the tip of his nose a little bit, and in the front profile you are noticing that there is a slight deviation in the nose bridge, and there's a portion of his nasal bones which is slightly shifted to the left side, and the tip of his nose is slightly turned towards the right side. So the idea would be to try to get his nose profile in an absolutely straight direction. You can also see in his oblique view this nasal hump is quite prominent. The plan for this patient was to reduce the nasal hump of the nose, and that is shaving a little bit of the bone and the cartilage on the bridge of the nose, trying to narrow a little bit of his nasal bones, trying to turn his nasal tip to the center, also shave off a little bit of bone which is on the left side and which is deviated. The septum of his nose was also deviated, and the plan was to try to correct it and bring it to the midline. Now let's see how his results were, and I have taken these pictures after 1 year. So after 1 year, we are looking and seeing what the results are like. We are seeing how straight his front nasal profile is. His nose tip is shifted to the center. The left side of the upper nose, which was to the left, is now in the center, and he has an absolutely straight dorsal profile. Looking at the side profile is where this patient is really happy, because the hump on the nose is completely removed, and now he has an absolutely strong and a straight side profile. The tip of his nose, which is drooping, it has been slightly upturned. Now one must know that this particular angle that we see here, called as the nasolabial angle, is slightly more in females and slightly less in males. It's about 90 to 95 degrees in males and about 95 to 100 or 105 degrees in females. Most of the women want to have a more sharper and upturned tip, whereas men do not want a very upturned tip, and they want a more natural looking nose, and they do not want a very small nose. So for him, we maintained the size but corrected his hump and slightly by 5 degrees upturned the tip of his nose. You're seeing in the oblique profile, the hump is corrected and he has a straight nose. The nose, which is downturned, is upturned and is slightly sharper than before. Once again, it is an open tip rhinoplasty. You can hardly visualize the scar. The scar is at the bottom in between the nostrils, and it's almost faded away at the end of 1 year. So rhinoplasty or the nose surgery is not just for females, it is for both men and women, and there are many men also who are distressed about the look of their nose, and rhinoplasty would be helpful for you if you are wanting to change your nose profile. So we would be very happy if you have concerns. Please share some comments about this post, about this video. You can follow us on our YouTube channel, Dr. Karishma Aesthetics. You can also visit our website www.kaesthetics.in and our Instagram channel, Dr. Karishma_aesthetics. You are more than welcome to walk into our clinic, have a consultation with me, and understand how better we can change your nose. If you want to know more, subscribe to our YouTube channel, Dr. Karishma Aesthetics, and make sure you hit that bell icon in order to get all the latest updates and videos.